Hi, good afternoon, and welcome. This is the South Dakota Healthy Nutrition Collaborative's Research and Programs Goal Areas informational webinar. We're happy you're with us today. Just as a quick reminder, the purpose of the collaborative is to bring a collective voice to support access to nutritious food, which builds a strong foundation for healthy South Dakota families and communities to prosper. We have three goal groups. The first is to improve coordination, identify areas for statewide research, evaluation, and promote programmatic best practices to improve South Dakotans' food and nutrition insecurity. And that's where this work falls under. The second is to elevate voices of food and nutrition advocates, researchers, and individuals experiencing food and nutrition insecurity. And the third is to advance policy implementation to improve food and nutrition insecurity in South Dakota. So, with that, I am very happy to welcome Dr. Lacey McCormack and Dr. Christy Hockett. And I just want to give a brief intro for them. Can you guys still see my slides or my screen? Okay. My computer is not doing what I need it to do. Okay. Briefly, Dr. McCormack is a research scientist at Avera Research Institute and associate professor at the University of South Dakota School of Medicine. Her research focuses on the rural environment, how it shapes diet and physical activity behaviors of individuals across the lifespan, and contributes to rural health disparities. She will be our first speaker today. Our second is Dr. Christy Hockett, and she's the Director of Community Research at Avera Research Institute in Rapid City and Assistant Professor at the University of South Dakota School of Medicine. Her research uses observational and community-based intervention methodology to understand how prenatal exposures and behaviors influence infant and childhood health outcomes, specifically in the areas of obesity, diabetes, and child development. So with that, I am going to turn it over to Dr. McCormack and Dr. Hockett.
Awesome, thank you. I will get my slide shared here. Okay. And you're seeing my big slides, not my notes?
Correct.
Okay, perfect. Thanks to everyone for joining today and being interested in the work that we are doing here at Avera Research Institute. I wanted to give just a very brief overview for Avera to start, talk a little bit about the Institute itself, and then get into a couple of the programs that we are doing that touch the food and food security spaces here in South Dakota. So the Avera system is an integrated health system that spans 72,000 square miles and touches 5 states, predominantly on eastern South Dakota, but portions of North Dakota, Minnesota, Iowa, and Nebraska as well. You can see here we have got a network of different hospitals and clinics, and then we also have Avera at Home, which does sort of remote patient monitoring and telehealth technologies. This is another view of that same Avera footprint, but what I like to show here is the 4 office locations that Avera Research Institute specifically has. So we have office locations and staff in Sioux Falls, Pierre, Pine Ridge, and Rapid City. One of the other things that I want to say about this is that we do have this footprint and are very fortunate to have connections across this footprint in these different communities. But our research and our programmatic activities are not necessarily restricted to this footprint. So yes, we leverage our position within the Avera health system and in the state, but we do work beyond these borders as well. The Avera Research Institute has been around since 1998, but our specific team under the leadership of Dr. Amy Elliott joined in 2017. We have about 75 full-time staff across our 4 different locations, and they help us to carry out a variety of research-related work. So at Avera Research Institute, we have sponsored clinical trials. So these are the sort of drug and treatment trials that you think about when you think clinical trials. These are many times physician-initiated trials and are carried out within clinics and hospitals. We also have epidemiological studies. This can be observational work, it can be intervention work. This is many times scientist-led, investigator-led work, and involves different cohorts and different networks we're a part of. We also have, in the last few years, really stepped into the program implementation and evaluation spaces. So different health system, healthcare, and public health programming, and then evaluation of programs that are happening across the health system as well. This work is led by 6 faculty. You can see our small but mighty team here. Our most recent addition is Dr. Kim McKay, who is our research medical director and a practicing OBGYN here at Avera. She's really helped to elevate our work in the healthcare programming space and in the maternal space as well. So now I want to switch gears and talk just a little bit about Healthy Start. This is a program funded by HRSA that was awarded in May of last year. We're coming up on our 1-year anniversary of having this funding and so excited about the work that we've been able to do in the community so far. So the Healthy Start program overall is a nationwide program. All Healthy Start sites are going to be aiming to enhance maternal health, prevent infant death, and eliminate health disparities. I put a map here so you could see the different locations across the US. This program itself has been operating since the early 1990s. So a very important program to support maternal and child health across the country. All of the Healthy Start programs that you see on this map are going to have a few common elements. These include case management, group-based education, and a community consortium. The way that each site implements these different activities is up to them, but we do all have ways of working in our communities that address these different strategies. At Avera specifically, our Healthy Start program was designed to sit alongside usual clinical care. So we visited with OBGYNs and pediatricians and asked them, if we could spend an hour more with each patient, what would you want us to cover? And so we're really focused on providing information, education, and resources to pregnant people, along with parents of children up to 18 months of age. Another really important component of our program is screening for and connecting people to behavioral health services. So we really built that out. And then incentivizing healthy behaviors. So we have the Teddy Bear Den here in Sioux Falls that does a great job of implementing a program like this. And we have modeled our incentive program after that so that we can provide the same types of resources and incentives to rural participants that are in this program. One of the things that we are also working on is enhancing educational opportunities and tailoring of all of our materials. And this is because we do serve a large immigrant and refugee population here in Sioux Falls, in addition to our rural population as well. One of the things that I'm most excited about in this program is our ability to identify and address social determinants of health that are barriers to our patients receiving care, accessing care, and other resources. So through this program, if we identify an issue related to transportation, we can help to address that. Maybe in Sioux Falls, it's a Lyft ride. Maybe in rural communities, it's a gas card, things like that. Also, if we identify an issue with food security, we are able to connect people to food pantries and food pantry resources in their communities. And I'll be talking a little bit more about what that looks like here in Sioux Falls. And just a little bit more information about our program in general. Our Healthy Start team is made up of a registered dietitian, a social worker, and then community health workers. Right now, we're focused on Sioux Falls and Pierre, but do plan to expand to the other larger towns on eastern South Dakota as well. Like I mentioned previously, we're able to provide referrals for behavioral health to address any social programming related needs. And then in Sioux Falls, we refer to the Teddy Bear Den and to the food pantry. We screen, we create a case management plan for each participant based on the needs that we identify, and then we tailor our information and education to those needs. And I just want to highlight the team that we have together so far. So we have Jess, our supervisor, Allie, our dietitian, Laura, our social worker, and Melanie, one of our CHWs. I know this slide is really busy, but the purpose of this is to show you the different touch points that we have with our participants across their Healthy Start program journey. So we can enroll as early as the first trimester and then be with participants and their families through their child's 18-month birthday. And so we have 3 touch points during pregnancy and up to 5 in the postpartum period. We're really using this to hopefully screen for food security issues multiple times, as well as behavioral health service needs multiple times as well. Okay, so now to get to the reason why you are all here, which is our clinic-based food pantry. This is something that we had worked on for about a year as the health system before we were able to officially launch in January. So the way this is working right now is that it's a partnership between Avera Healthy Start as well as our clinics and then volunteer services here at Avera as well. So we do centralized food ordering for our clinic-based food pantry. The food gets delivered to Plaza 5 here on the Avera campus. We have volunteers and our staff help to unpack that food, to get it onto shelves, get it organized, and then get it into bags to be distributed. And then we are responsible for getting that food to the clinic, which right now is in Plaza 1. Once in the clinic, it is our providers that are screening our patients. They're using the 2-item food security screener to identify food insecurity and then offering a bag of food to patients right then and there if they screen as positive. The clinic staff are also then documenting those responses in the EMR. They're documenting a little bit of information about the household and then how many bags are given out. So this has been a really great partnership and has been a good way to get food into the hands of people right at the time the need is identified. So right now, we are focused on our women's and children's populations. On campus at McKinnon, we are also doing this screening, documentation, and distribution at the Avera Research Institute because a lot of our research study participants are maternal and child populations as well. And then we have plans in the next couple of months to roll this out to additional satellite sites. So all of the ordering will still be centralized. It will still come to Plaza 5, but we'll be able to get it out to additional clinics who will then screen, document, and hand out food as well. I wanted to give you a couple of pictures of what this looks like. I remember the first day we got our delivery, a giant semi from Feeding South Dakota showed up and we're like, oh my gosh, we're not gonna have enough for whatever they're gonna give us. No space for all of this. And it ended up just being like 2 pallets on that whole entire semi. But it did take up a lot of space. It was enough food for 100 families. And we were so lucky to have volunteers show up on that first day to help us as well. So in this picture, you'll see a mix of both ARI staff as well as some regular volunteers we have from the American Legion that help us to unpack these pallets of foods that we get. This is our storage space in Plaza 5 and what this looks like when it's all neatly stacked on the shelves. We have it set up so that volunteers can walk in and read a set of instructions and know how to pack bags if that were to ever be the case where it was just a strictly volunteer run operation. Here is, again, the first day that we were doing this. We sort of have a model where you walk around the room with the bag and place in the different numbers of items that go into each bag. This is one of our packed bags. This is what gets handed out directly to our participants. I would say that this weighs between 15 and 20 pounds when it's fully packed, and it's meant to be an emergency food supply, so to last a few days for each of our participants. This is the team that was working together on the first day to make this happen. And then I just wanted to share our Healthy Start contact information, and note that right now this program and our clinic-based pantry services are available just to Avera patients just because of some program requirements and where they're located. But we're happy to serve any and all Avera patients however we can. And now I'd like to turn it over to Dr. Hockett to talk about food as medicine.
Great, thank you, Lacey. I'm going to talk a little bit about the Food as Medicine project here at Avera Research Institute, and then also a observational study that we are doing called ECHO. Okay, so what got us started on the Food as Medicine project is really the food insecurity that we were seeing in South Dakota, and specifically for this project in Sioux Falls. We also recognized that there's many rural challenges when we think about food security, around accessibility, affordability, but also availability. Go to the next slide. So for the Food as Medicine project, we really have three research questions that we're interested in. First, does food as medicine increase fruit and vegetable consumption and food security? And then the primary outcome of interest is, does food as medicine improve the clinical outcomes? So we're looking at BMI, lipid panels, and A1Cs, as well as blood pressure. And we wanted to really understand, how do these clinical outcomes improve, and are they different by mode of delivery? So we'll talk a little bit more about that in just a second. So food as medicine, we also call this FAM. And this, when we think about food as medicine, the primary intervention here is providing food incentives to eligible participants. For those enrolled into the program, if it's 1 to 2 adults in the household, they are provided $25 a week for 6 months. And if it is a family, so if it's 1 adult plus 1 child, then they are allotted $50 a week. We then kind of renew this prescription at the 3-month visit, and we do allow for a remote option for this visit. When I talked about one of the research objectives is really around this mode of delivery, we, for every person enrolled into this program, we randomize them. So they have a 50-50 chance we select, or we randomize them into either an in-store voucher method or produce box delivery method. And so 50% of our participants are randomized into this in-store voucher. This is where they receive monthly vouchers, are sent to them in the mail. You can see an example here at the bottom of this of the screen. And the vouchers are in increments of $5 or $5 to $10. And again, they're provided 25, on a monthly increment there. They are allowed to be used at any of the Hy-Vee stores in the Sioux Falls area. And then we also collaborate with the Sioux Falls mobile market, and they're allowed to use the vouchers at the mobile market as well. And then the second mode of delivery is around a produce box. Hy-Vee is, we work with Hy-Vee or collaborate with Hy-Vee in delivering these fresh produce boxes to the participants that have been randomized to this arm. The way that we do this is really, we create a food calendar each month that we provide the produce managers at each of the stores. And they pack the produce box with these items. And these items are specifically selected based on the season and what is available within the stores or in season during that time. Next slide. Yep. So if we think about kind of the structure of the study, this is a 6-month program. We have 3 study visits. So they come in at baseline. We have a 3-month renewal. Again, like I mentioned, a remote option for that. And then we ask them to come in at their 6-month visit and provide a small incentive for them coming in and completing that final visit for us. We do provide monthly newsletters. These newsletters contain nutritional education. A lot of times we are reusing information that is created by the SDSU extension, or maybe something that we have found on, like, for example, this is myplate.gov. We also have a food spotlight, so we highlight a particular food. Maybe here, I believe it's Brussels sprouts. You can see on the right-hand side of this newsletter example. And then we teach or discuss how you select Brussels sprouts, how you can store them, the benefits that you receive from this particular food, and then any tips and tricks that you may want to try in preparing this vegetable. So really trying to educate those participants maybe on some vegetables or fruits that they haven't necessarily or aren't necessarily too familiar with. And then we coordinate a food recipe for that month, and the food recipe is picked based on the food spotlight that we have for that month. So the recipe always contains the food that's highlighted for that month, and then we make sure that in that food calendar and the food that they're receiving, particularly with the produce box, they are also receiving that particular food that month. And so they kind of are all coordinated together, and they can try it. And then we also just have a fun food-related activity like crossword puzzles or word scrambles for adults and kids, whoever would like to complete them. Next slide. So if we think about the study flow or the study flow, we recruit, and we'll talk about recruitment sites in just a second, but we recruit out of multiple places. When they get referred to ARI, our staff, our FAM staff will confirm eligibility and consent the participant into this research study. Once they are consented, they are then randomized into the voucher or produce box arm. And then based on which arm that they are randomized into, they get kind of this welcome packet that kind of tells them how they can use either their vouchers or how the produce box delivery arm is going to work, and kind of walk them through that process and what that's going to look like over the next 6 months. At the baseline visit and also at the 6-month visit, we do anthropometrics and a blood draw. So this is just your basic kind of lipid panel, A1C, cholesterol, triglycerides. We do waist circumference, height, weight, etc. And then we ask them to complete a questionnaire, both the adults, and then if the children are interested in participating, we do allow them to participate. They do not get any additional incentives necessarily, but we have found that some kids just get really excited about research, which we love, and we want to support that enthusiasm. And so we allow them to participate and answer questions if they're interested in. We have these questionnaires completed at baseline, 3 months, and 6 months. And that is the study components. So next slide. So if we think about eligibility into the program, to be eligible, you have to be eligible. You don't necessarily have to be enrolled, but you have to be eligible for SNAP, WIC, or Medicaid/CHIP. You have to live in the Sioux Falls area. Currently, this program is just focused on Sioux Falls. However, we'd love to see this expand elsewhere in the future. And then participants must be 8 years or older. So a lot of times I would say a majority of our participants are adults. However, sometimes the child may be eligible, but the adult may not be. And so that's why we have this criteria as participants must be older than 8 years or older. But if the child is eligible, then they have to have one parent or guardian willing to participate in the study. And then we do provide both English and Spanish speaking options. And so we have recently rolled out, I think about 12 months ago, we rolled out the Spanish option, and we've been really excited to be able to offer that for our community members. So we recruit from a variety of locations, primarily Avera clinics. So PCPs have the ability to either provide kind of these RAC cards to participants, and the participants are able to call us. We also have online EMR referrals that can be electronically sent to our staff to follow up with patients that are eligible for FAM. We also work with work closely with the downtown clinic and the Eat Well Sioux Falls mobile market, where we sit down every other Wednesday at the downtown clinic and conduct eligibility and clinic visits at the downtown clinic. And then we coordinate with the Eat Well mobile market. So if a participant is enrolled in the study and receives the vouchers, then they are able to use those vouchers at the mobile market right when they walk outside the clinic. And then we also work with Center of Family Medicine, and then are actively participating in community events where we do live recruitment as well. Okay, so that wraps up Food is Medicine. And then the other study I just wanted to briefly talk about is the ECHO study, which stands for Environmental Influences on Child Health Outcomes. This is a longitudinal observational study that is conducted nationwide. I'll show you the clinic sites in just a second, but the ECHO program objectives is really to improve the health of children and adolescents by conducting observational intervention research that will inform high impact programs, policies, and practices. And so we really are gathering information on and looking at the effects of a broad range of early environmental influences on a variety of child health and development outcomes. So next slide. So this just briefly shows you a map of all of the ECHO, because this is a nationwide study, this shows you a map of all of the ECHO study sites. So you can see those in blue. You can also see ECHO ISPCTN, which is a pediatric clinical trial network. I'm not going to focus on that right now, but we actually are one of the few sites that participate in both of those kind of ECHO arms, if you will. But for the ECHO cohort study sites, we started participating in ECHO in 2016. We were recently renewed in 2023. And through this renewal, we have developed one shared harmonized protocol that we have now implemented into the field and will continue to implement and conduct over the next 5 years. There are 45 cohort awards and 77 study sites, and we have already enrolled 6,000 new pregnancies, which are on our way to, the total new pregnancies that we're looking to enroll nationwide is 30,000, which will then, those children will then be added to the 30,000 that we're already following from extant cohorts from the previous cycle. So if you go to the next slide. So if we think about ECHO outcomes and exposures, ECHO focuses on 5 key pediatric outcomes, and these outcomes were really selected because of the high public health impact that they have. So the first outcome is pre, peri, and post. The second one is upper and lower airways. So this could be something like asthma or allergies. We have obesity. This can be anything from BMI, but also it's expanding into cardiovascular health and metabolic health as well. Neurodevelopment, this could be something like executive functioning, autism, anything into that area. And then obviously, and then also positive health. And then if we think about, because we're interested in these, not only the outcomes, but the exposures that potentially impact the outcomes, we think of this in 3 different areas, exposure areas. We have lifestyle, physical, chemical, and psychosocial. So I'm just going to briefly talk about a particular work in progress. So this is a current analysis that we're both Dr. McCormack and myself are working on, and how ECHO could help support some of the food initiatives that we're doing here in South Dakota. We are currently looking at how environmental food factors at a community level and then also individual socioeconomic factors are associated with fruit and vegetable and sugar sweetened beverage consumption in children. And then we are really interested in seeing how these factors may be different based on rurality status, especially here in South Dakota, where we have a variety of different levels of rurality. So more to come on the analysis. We're just wrapping it up over the next month or 2, and we'll hopefully be able to present some results soon. And then I just wanted to, for those interested in kind of better understanding ECHO and the data that it provides and the research that it's conducting, if you visit echochildren.org and you go to the publications and research findings section, they have a really great area that provides research summaries or study results that summarize maybe 5 papers on a 1-pager. And so they really have some great dissemination material, both for the community members, but also investigators or researchers, or just people who are interested in learning more about how these early factors can influence child health. And then also this QR code, the ECHO program has created an ECHO connector, which you can subscribe to. So you don't have to be a part of ECHO. This can be any community member. You can subscribe and you would get a monthly newsletter from ECHO kind of outlining what the consortium is up to, highlighting some of the research findings or research articles that investigators, a part of the network, have maybe published, and just different events that are going on related to ECHO. Okay, and then that just wraps up some of the things that are happening at Avera Research Institute. If you have any questions, please feel free to reach out to Dr. McCormack or myself, or email or call us at ARI. Thank you.
Thank you, both Dr. Hockett and Dr. McCormack. A lot of information. Thank you for condensing it down into about 40 minutes. Really appreciate that. I'm sure that folks have questions, so this is the time for questions for Dr. McCormack or Dr. Hockett.